Cuba is the largest and most populated island in the Caribbean, home to approximately 11.2 million people. Known for its vibrant culture, revolutionary history, and stunning landscapes, the island offers a captivating mix of urban energy and natural beauty, from Havana's lively streets to the serene tobacco fields of Vinales. Cuba also prides itself on its unique healthcare system, which provides universal and free access to medical services, and boasts the world's highest doctor-patient ratio. However, this system is currently under immense strain. Shortages of essential medications and resources, exacerbated by the US embargo, economic challenges, and the lingering effects of the COVID-19 pandemic, now pose serious issues. Alarmingly, about 70% of essential medications are unavailable. These shortages also apply to contraceptives, which are critical for family planning and reproductive health. This documentary delves into the impact of contraception shortages on family planning in Cuba, told through the voices and experiences of Cuban women and doctors. The World Health Organization defines family planning as the ability of individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. This is achieved through contraceptives and infertility treatments. More than a healthcare service, family planning is a fundamental human right, essential for personal autonomy and societal progress.
La planificación familiar en Cuba está organizada desde la atención básica de salud, la atención primaria de salud. Ya en los consultorios se identifican las posibles familias que quieran tener descendencia, se identifican los factores de riesgo que pueda tener esa familia y se le garantiza información, medios, métodos que facilitan que la familia o la persona pueda planificar la cantidad de descendientes que tengan, el momento que tengan, el intervalo entre uno y otro. Entonces, si la familia desea embarazarse o no, se llega aquí a un consenso, uno le explica y se pueden utilizar diferentes métodos anticonceptivos en dependencia de cada paciente, de la edad, de las enfermedades que tenga, de las condiciones, de la accesibilidad al método anticonceptivo.
In Cuba, intrauterine devices are the most commonly used form of contraception, accounting for 52% of contraceptive use, followed by sterilization at 23%, condoms at 14.5%, and hormonal pills at 8%. Abortion is legal and widely accepted, provided it is performed in approved health facilities by trained professionals, and with the pregnant individual's consent. Sexual health education is widespread, although Cubans living in rural and impoverished areas have less access to information and services.
Bueno, mi nombre es Daniela Blanco y estudio enfermería primer año.
Igualmente, Melanie Castellanos y también estoy estudiando primer año de enfermería.
Y entonces, queremos hablar sobre las anticoncepción y la family planning. Entonces, ¿cuáles son sus experiencias con la anticoncepción?
Bueno, a ver, desde octavo grado nos enseñan que tenemos que usar anticonceptivos para tener relaciones sexuales y se usa con frecuencia.
Los anticonceptivos han enseñado desde que entramos en la etapa de la adolescencia, que es cuando más se va adquiriendo un poco más de responsabilidad, que es cuando mayormente se empieza a tener las relaciones sexuales, como un ejemplo hoy en día las jóvenes. Los anticonceptivos se aplican para evitar el embarazo en temprana edad y evitar complicaciones. Hay varios tipos de anticonceptivos, o sea, las que se inyectan,
El DIU, late de cobre,
el AI, HE, que estas se utilizan en emergencias, en caso de alertas.
¿Y tú usas las anticoncepción?
No.
Sí.
¿Y qué usas?
El preservativo. Preservativo. O sea, el condón.
Ah, sí, ¿Y por qué usas eso? ¿Por qué no la vacías?
No, yo no soy mucho de poder tomar pastillas por tema de alergias y estas cosas, y entonces lo que recurrí a eso.
Cuba's family planning services are well structured in theory, and evidence shows that free access to contraceptives can reduce teenage pregnancies, abortions, and birth rates. However, these benefits are out of reach without consistent supplies of contraceptives like IUDs, oral pills, and condoms. In 2019, 12% of unmarried women aged 15 to 24 experienced an unmet need for contraception, while the contraceptive prevalence among married or in-union women was 77.2%. However, contraceptive shortages have only increased in the past few years. Supply inconsistencies are especially prevalent in impoverished and rural regions such as the eastern provinces. Supply of condoms and hormonal contraceptives in particular remains insufficient. Our interviewees had mixed experiences with acquiring contraceptives.
Well, it's definitely not everywhere. You have to go to a doctor, or in the case of condoms, you can go on Facebook. There are groups on Facebook in which you can buy them. Different types of groups, groups for buying in Havana and groups for buying in other provinces. And there's also like WhatsApp groups for people that sell them, like buy them in the US or other countries and import them and sell them. Sometimes you know someone that knows someone that sells them. It's definitely a struggle sometimes, but if you look really well, then you can definitely find them.
So you always have access to them?
Most of the time, yes, I do look for them. Condoms, it's curious because sometimes you get like one that's like really good quality for like 50, 100 pesos, but sometimes you get like 3 for 100, but like less quality. It depends on the brand. There are different brands. We have a national brand, but those aren't really that good. They're really cheap, but they're not that good. So we prefer to pay more and just be safe.
¿Es fácil adquirirlo? Sí, es fácil.
¿Y tus compañeros?
También.
I think the government definitely sees it as a priority, but they do have to work and do a better job at making contraceptives accessible to the public, like at a price that's not like twice a salary. They definitely have to. They used to sell condoms at the pharmacy. I think they should really try to do that again more, make it cheaper for people to get. And I think they're doing a good job at informing us, because I do see a lot of ads on TV about Planned Parenting or the places you can go if you need like guidance on the subject. But as for contraceptives, I think they do need to make them more accessible. Like, they do have strong points, but they have weak spots in that area as well.
For many Cuban women, the economic reality further complicates family planning. With an average monthly salary of just 4,648 Cuban pesos, which is barely enough to cover basic needs, raising a child often becomes an overwhelming challenge. These financial pressures, coupled with mistrust of contraceptives and limited availability, frequently lead to reliance on abortion. While abortion is a culturally normalized option, it is often chosen out of necessity. Cuba's abortion rate of 30.4 per 1,000 women aged 12 to 49 parallels rates in high-income countries.
A ver, la pregunta que me hiciste fue si hay escasez en métodos anticonceptivos. Sí hay escasez con los métodos anticonceptivos, y esto ha traído consigo un aumento en el número de embarazos no deseados, de abortos provocados y de aumento en la incidencia de enfermedades de transmisión sexual.
Sí, y en su propio trabajo también, ¿también ves los efectos de eso?
Sí, porque hay aumento en el número de embarazadas con enfermedades de transmisión sexual, vemos embarazadas con sífilis, con herpes, con vulvovaginitis, es decir, leucorreas, que también se consideran enfermedades de transmisión sexual porque la mujer se la transmite al hombre y el hombre le infecta a la mujer o también se la puede transmitir al no haber un coito protegido, es decir, al no usar condón como método anticonceptivo de barrera.
Bueno, es una realidad que ahora la situación económica del país está afecta a todos los sectores, uno de los cuales que está afectado es el de salud pública. Es decir, que hay cierta dificultad a la hora de adquirir estos métodos anticonceptivos. Entonces aquí existen programas priorizados. Dentro de los programas está el PAMI, que atiende a los adolescentes en este programa. Es decir, que hay consultas especializadas para las adolescentes cuando empiezan a tener relaciones sexuales, y hay un poco más de disponibilidad de recursos para las adolescentes, que en las consultas se le garantiza, si hay tabletas anticonceptivas que son para las adolescentes, se le trata de garantizar, se le hacen estudios, se le da atención específica para el grupo de adolescentes.
¿Qué tipo de complicaciones tienes embarazos adolescentes?
Entre las principales complicaciones son la prematuridad, es decir, las gestaciones menores de 36.6 semanas. Aparte de esto, hay aumento de niños que nacen bajo peso, y durante la gestación hay incidencia o riesgo de un crecimiento intrauterino retardado. También se ve enfermedad hipertensiva durante el embarazo, y estos niños que nacen de mamás adolescentes tienen un mayor riesgo de mortalidad en los primeros 5 años de vida.
The consequences of contraceptive shortages are profound. Condom shortages in particular are a dual threat, increasing the risks of unintended pregnancies and sexually transmitted infections. Between 2015 and 2019, there were 72 unintended pregnancies for every 1,000 women aged 15 to 49, with 77% ending in abortion. In comparison, there were 18 unintended pregnancies for every 1,000 women aged 15 to 49 in the Netherlands, of which 39% ended in abortion. Teenage pregnancies in particular remain a pressing issue, with 49 out of every 1,000 girls aged 15 to 19 giving birth in 2022. This figure, while lower than the regional average, is significantly higher than that of many upper middle income countries. For example, the rate in the Netherlands is just 3 per 1,000. Teenage mothers face higher risks of complications such as eclampsia, infections, and premature births, while their babies are more likely to be born underweight or with severe health challenges. Teenage pregnancies also disrupt education and reinforce poverty cycles. Family planning is not merely a personal choice, it is a cornerstone of public health and human rights. Addressing shortages is an essential step towards ensuring that all Cubans can make informed decisions about family planning and their reproductive health. The biggest strength of our documentary is that we managed to obtain the perspectives of several Cuban women, both doctors and civilians. However, it lacks the views of Cuban men and Cubans living outside of Havana.